our research is very much interested in the biological underpinnings. In other words, what goes wrong in the brain when someone has PTSD. The changes that we see in the brain are very real. People think just because you can't actually see a physical break that there is nothing wrong. Now, if you look at someone with post-traumatic stress disorder, what happens is they lose neurons in 3 very specific locations in their brain. So the loss of neurons, which we absolutely see, explains a lot about the symptoms that we see in people with post-traumatic stress disorder. What we also see over time is a gradual disruption of some very important neurochemicals in the brain, in particular those that control the brain's excitatory and inhibitory processes. And of course that happens as a consequence of the loss of neurons. Post-traumatic stress disorder is essentially a collection of symptoms that one experiences after a significant traumatic event. These can include hypervigilance, it can include flashbacks, it can include sleep disturbances, but also cognitive symptoms such as memory loss, attention and concentration problems.
Post-traumatic stress disorder, or PTSD, is really made up of 4 symptom groups. And really the basis of PTSD is having re-experiencing memories of particularly traumatic events, where these memories continue to come back to you. And they come back involuntarily, and they're associated with attempts to try and push them away or not think about them, a sense of being keyed up or on edge and on the lookout for signs of danger, and a sense of being shut down and disconnected from other people and disinterested in other activities.
So some people may have more somatic symptoms where they have hypervigilance, racing heart, they might have sweaty palms. It really affects their normal everyday life, whereas another person may react a little bit differently. They may have more cognitive changes, memory disturbance, sleep disturbance, concentration and attention. And whilst they are all the same condition, often it's very hard to basically link those 2 together.
PTSD rarely exists on its own. It's often associated with problems in anxiety, depression, and not uncommonly substance abuse of some kind or another, most commonly alcohol problems.
An individual following a traumatic event has psychological distress symptoms, but these cannot be diagnosed or classified as post-traumatic stress disorder until 1 month has elapsed. Now that's an arbitrary time that's been attached to it, but what it's trying to describe is that any individual, if exposed to a horrible circumstance, requires a period of time to psychologically adjust.
What's unique about PTSD and veterans is essentially that the probability of PTSD in veterans is almost double that of civilian population. Of course, you can get PTSD just being a civilian, so you could be walking down the street and experience a horrific car crash, and that be enough to tip you over and for you to develop post-traumatic stress disorder. But of course, the chance of that happening is probably a lot less than if you are in the armed forces and you're on the front line and you're constantly seeing very significant events, traumatic events.
And certainly those prolonged periods of deployment to high threat environments changes the way the body reacts to stress and can often be fertile ground for PTSD in the aftermath of further traumatic events.
Well, there's a lot of work that's being done now by the armed forces and other areas in regards to profiling people, characteristics of people, which makes them better suited to these type of roles. People who fit the profile of potentially not getting PTSD. But of course, these tests and this screening is not foolproof. A good example of this is you have a single person that goes into the army, they get screened, and of course they pass with flying colours. Now, in the years that they're in the army, they've met a partner, they have a child, they get deployed again, and there's a context now whereby there is maybe a young child in a traumatic event that they experience. The context for that soldier now has completely changed because the trauma now has taken a different context, and it's much more real and much more significant for them.
For those people who have experienced that sort of post-traumatic stress, the path to recovery, the journey that they are on, can be quite a challenging and arduous one.
The key message with PTSD is that it is a real condition, and it's a condition that won't go away if someone basically says, just be brave, just get over it. You can't. It's a real condition with real brain changes, and there is help out there that can help both the veteran who is affected and of course the immediate family, and that's very, very important.
With the right work, in the right ways, with the right people, people can move to a more resilient emotional and mental space than they were before.
It needs to be understood and acknowledged that PTSD causes enormous distress for the veteran themselves, but also for their families. We do have services out there for veterans and for their families who can make a big difference in terms of reducing symptoms, improving quality of life and a general sense of well-being.